Kia ora and welcome to another episode of The Leadership Lounge, a space for healthcare leaders to take a moment, to take a breath, get a pause in their week and their day, and for you to get some fresh perspectives on, or ideas or inspiration, hope, encouragement. Take what you need. This is the place for you to be for a short period of time. I'm Katie, I'm your host, and I've worked in healthcare for over 30 years now, and I get to work alongside teams and their leaders so that they can feel inspired, supported and connected with each other so that they can manage the complexities and the demands of the work that the work requires right now, let's be honest. So over the last few weeks, I've spent quite a lot of time in conversations around this idea of teamwork and teams and working with teams. So a lot more in this team space. And one of the things that has been useful is to really make sure that we are all clear on the definition of words when we're talking about things. So like trust or respect, there's these big words that are out there, and we can make this assumption that we're all talking about the same thing or that we understand the same thing. So there were two words that I wanted to explore a bit today, and that is cooperation and collaboration. Now, they often can get kind of like thrown into the mix interchangeably, and there probably is a Venn diagram of some description over that. In fact, there are, because I have been searching this and fell right down a rabbit hole in terms of the difference between cooperation and collaboration. There's quite a lot of stuff out there, all I can say. So I've looked at a number of those things, and I'm going to pull it into a very pragmatic, practical setting for us in terms of what it means for you if you are working in a team or if you're leading teams, or if you're just working in healthcare really, because there's some value in both. So if we're thinking collaboration, what I've learned and what I have grasped from reading all the stuff is that it is about having a shared objective. You have got shared ownership, you have shared interest in the outcome. So you're really thinking here that it is working together towards a shared goal with shared accountability. So cooperation, on the other hand, is helping each other, but with separate goals. So it's that you, for example, the best way of describing this is an example. So a simple example would be that cooperation is that you're helping a teammate with a presentation or a report that they have to do. But at the end of the day, it's their report, their presentation. But you are cooperating with them to help them get all the data or whatever it is that they need, or just how to put the slides together. So that's cooperation. But collaboration would be that it is your shared goal to produce this report and that you're working alongside each other, working together. So subtle, you see what I mean about the subtle difference. So if we put it into a couple of healthcare examples, let's have a think about this. So let's say a doctor refers a patient to a physio, they're cooperating. But if they're sharing information and the responsibility for the patient is still largely separate. The physio's got their goals, what they want to achieve. The doctor's got their goals and what they want to achieve. But if you get the doctor, the physio, the nurse, the social worker, all of the pharmacist, definitely bring the pharmacist in, and you are sitting down to co-design a recovery plan, and you're factoring in all the things that are important to the patient, and the patient's involved in this conversation as well. You're not just sharing information and passing it around each other and completing your own tasks off. You're owning the outcome together because you're all invested in this. So you've got this shared interest in the outcome and you're actually doing it together. Another example might be if you are got to design a new model of care or a new budget. An interesting topic right now, eh? But so you could have the administrative, management people doing their bit and going, this is what we need, blah, blah, blah. You've got finance saying this is what it is and this is what it looks like. And you've got the operations people that go, okay, we might need this. Here's some data that's going to help. This is what this looks like. But if you bring in the leaders who are patient-facing or involved in those actual teams, and then you actually have a conversation together, you co-create something. So there's a lot about this working together for a shared purpose, and a shared outcome. They're not just thinking, I just need to get my budget to be fixed. I just need to have the right number of staff on the shift. You're actually coming together and you dig a bit deeper because you're actually asking, why does this all matter? What are we trying to achieve here? And you're getting on the same page. Now, it is also important to realise that cooperation we need cooperation. It's not kind of like we should always be collaborating. There are some moments that cooperation is really important. It keeps things moving, for example, and you can run a risk of over collaborating almost in some aspects, whereas actually what you need to be doing is cooperating with people. Now, cooperation is good because it can allow people to contribute to a project without having to take on this massive ownership role. And at times when you've got limited resources or you're feeling a bit stretched or overwhelmed, that can be really useful. So you can cooperate and take part in something, but you're not having to sort of wear the weight of the whole project, if that makes sense. But with collaboration, then you can see yourself as part of something bigger. So this is why, and I'm thinking as healthcare systems are at a state where they need to evolve and almost reimagine themselves in the current context, and whether that be about the politics, whether it be about the resources, and by that I mean the amount of money that they are given, or whether it be about the people that they have to achieve the work that needs to be done, we kind of need to create something new. And we kind of have got to kind of take this ownership together because, I think healthcare is full of a lot of very smart people. And with the challenges and things that we have got and are facing, if we knew how to do it, we would have done it, right? These are hard problems because they are hard problems. And so just sticking within our lane in that cooperating kind of space, this is my job and this is what I do, we're not going to create the new thing that we need to manage and evolve healthcare into what it could be in the current context. I hope I'm giving a sprinkling of inspiration and hope around this, because while it may not feel like this is what's happening, this is what I believe is possible if we start to understand that space of how do we collaborate. Because the bonus of collaborating is that you've got this kind of shared purpose, and you can take it from a small few teams to the massive big system, whichever way you want to look at it, blow it up or bring it right down. And you are starting to believe that you are part of something bigger, that you're all here for the same reason. And then that enables this space of collaborating to create what we need to do for that, to achieve that shared purpose, those goals that we're setting together. So there's a real power in collaboration. That's what I guess that's the bottom line around things. So another example that might help to sort of pull out and tags into my nursing background, and I think about the way a group of nurses, and I'm going to go hospital based, so for all of those people I now get to work with in all the various other settings other than hospitals, please forgive me. I'm going back to roots, I suppose, in terms of this working as a nurse on a ward in a hospital. You've got your group of patients. I've got these however many patients I need to look after today, and I've got my list of tasks and I'm working through them and I need a bit of help. So someone comes and helps me. So that's cooperating. So the groups of nurses, all the nurses on the shift for that day cooperate with each other by giving a bit of help here and there. And that's fine. But at the end of the day, these are my X number of patients and I need to work through this task list. And that can get a little bit daunting. You might not get the help when you need the help. You might struggle with some bits. You might forget some bits. You might not have particular strengths in some areas that are required. So let me flip that to a space where we can think about how do we collaborate rather than cooperate in that setting. We actually see our patients as all of our patients. They're not my patients, they're patients. That's, one of those things when the bell goes off, that's not my patient. So there are patients. We have a shared purpose for this shift. We're going to deliver the best care that our patients need. So let's think about how we can do that best. And yes, we're still going to divide up some of the things and do some stuff. But if we're in this state of collaborating rather than cooperating with each other, we're making the most of each other's strengths and skills. And we're actually not leaving anyone behind. We're working alongside each other in this very different mindset. So it is a mindset shift, because rather than, so this is my patient and I'm not going anywhere else, we're invested in the fact that this is all of us. This is all of our patients. So it works from a ward nurse perspective to let's bring in all the allied health and the numerous, at least 42 types of allied health professions out there. So it brings in that aspect, brings in the medical teams as well, and all the other support structures that are sitting there within that. And then it goes beyond that one ward, right? I remember one of my proudest moments. Oh, look, Adam's phone in the background. Didn't remember to take the phones out of the room. Hey ho. So one of my proudest moments when I was working as a charge nurse was that on the one occasion we started talking about, why are their patients doing this? Why do we have to look after their patients? About a year later, when we've been working a lot on this idea of teamwork and what are we there for, a whole load of stuff, the same conundrum arrived. It was around the Christmas period when some wards are shut. And the same person, I kid you not, the same person came to me and said, hey, if we did it like this and this and this, then these patients will get XYZ. And her mind shift had changed. She had no idea, no recollection of what she'd said to me the year before, or no memory of it, or she didn't show that she did. But she was now considering these patients as part of our patients, not their patients. So it's a really important mindset. And I'm getting excited now. And as a leader, you have the influence, the potential, the opportunity to role model and to set that tone. So it's really important for a leader to understand that idea of being invested in the bigger picture. Now, why do I think this is important right now? Because what I see and hear and I'm picking up on, and I was on a session the other day, and as I started talking about this, there was a lot of nodding going on. So I think it was resonating and landing. That the pressures, the demands, the burnout, the overwhelm, the limiting of resources, the restructures, all of that sort of stuff, it is scary, it is frightening, it is all of those things. And all of those actions make us look inward and kind of like become defensive, and you want to protect your own. So rather than our multidisciplinary working or breaking down the silos or interdepartmental collaboration increasing, which is exactly what we need at times of restraints or, constraints and restraints, we're all being tied up. I didn't mean that. Oh God, I'm into restraint now. No. At a time of resource constraints. That's what I was trying to do. I was trying to combine the word resource and constraints in one go. That was quite exciting. I'm just making up words now. So at times when we've got resource constraints, it's even more important that we are collaborating and looking wider. The converse is happening. So we're actually becoming really defensive, and silos are getting stronger. We're putting up more barriers and more walls. So as a leader, you've got this real opportunity to start looking up and out and seeing that bigger picture, seeing you as part of something bigger. So I get super excited about thinking about the healthcare system as a whole and my part that I play within it and everybody else's part. And I think there's the opportunity for you as a leader to encourage that, to role model that, and to help that mindset shift, so that we can start to work in this collaborative way around the work that we are doing. But again, not forgetting that cooperation has its place and is really important as well. So it's not that one is better than the other. It's about using the two appropriately. Okay. The key to all of this, as I was reading through all the stuff and looking at all the notes, and there's a lot of groovy diagrams as well out there, as I have to say, being Venn diagrams and all sorts of other things, explaining the difference and the various different components. And as you know, I will put a whole load of links to some of those articles that I found, the most useful ones, and some of those diagrams. But what really struck me as I was making my notes was that underlying all of this was this sense of a shared purpose. And I think that actually has a number of benefits beyond this idea of how do we collaborate and how do we understand when to collaborate. But it really does connect with it. So this idea of a shared purpose, what are you here for? Why are we here for? And you can do that as a team. You can do that as a wider service. You can take that big and you go, what is the health system here for? What is our shared purpose for everybody that works in the health system? Isn't that a cool question? And then you start to realize that you are part of something bigger. Now, if exploring your shared purpose and why you are here is something that you haven't done or something you're interested in, because it is a powerful thing for a team to look at, and probably where my thinking started. Because when you have teams that are either not communicating well with each other, they're not getting on, or you're struggling with some behaviours over other behaviours, one of the first steps to do is to really clarify down as to, are you all sharing the same reason why you're here? Different people are going to have different motivators and drivers for why they do what they do. So we've all got our individual drivers, and it's often worthwhile doing a bit of work in that space for people so that you can understand it and share those ideas. But you take that and then you go, okay, so what are we here to do together? What is our shared purpose and what is it only we can do? So there's some good prompts that you can use to help work your team through, and it's not a complicated conversation. It is just that. It's a conversation that you can have, whether it be part of a team meeting, whether you do it via a sort of a poll or an email, or there's lots of different ways that you can do it. So what I've got for you, I'm going to pop in the links again, and the resources is just a really simple, short cheat sheet almost of finding your shared purpose for your team. But I'd encourage you to add that extra one in. Go big. Let's think about, what is the health system here for? What is the shared purpose of it? What's the vision around this? So it does connect in with vision a little bit and mission and all that kind of stuff. Maybe that's next week's. Oh, look, I'm even going to write it down because I happen to have a pen here. The difference between a mission statement and a vision statement. So that's another interesting conversation. This podcast is taking a turn, I feel. All right. So what have we covered today? The importance of teamwork, that actually it is teams. I often would say teams is where the magic really happens, but it connects with that fact that we can't do this stuff alone, that we require the strengths, the talents, the experience and the wisdom of others to enable us to deal with the complexity of what's going on in front of us, as well as the workload, right? We can't do it all. We can't do it all. So where are the moments for understanding what collaboration is, what cooperation is, and where they are best used, and what the opportunities there are for you as a leader to help shift that mindset for people so that you can start seeing it as themselves as part of something bigger. Because then we've got the opportunity towards how teams work and transforming that work to then shape the future of healthcare, which is very, very exciting. And the thing that helps pull that together and give you a place to start is this idea of finding your shared purpose. So maybe there are a few different teams or departments that you're all kind of playing around in the same field, maybe thinking about, okay, what is our shared purpose here? So there's so many opportunities for conversations. I get excited by that thought. All right. Thank you for listening again to another episode of The Leadership Lounge. I hope you've enjoyed this one. Remember to put a like or a comment or a follow, and I would love it if you would pass this along, share it with people that you think, oh, this would be a great conversation for us to have. If there are people or teams that you want to collaborate with or get more cooperation with, maybe share the podcast with them. And remember, you can sign up for the weekly Bright Spot into your inbox at katiequinney.com/subscribe, or noodle around on the website for the collection of free resources that I've got there for you, all designed to help you as a leader, someone who cares about the healthcare system. All right. Thank you again. Great talking to you. Love, love, love it. And I will see you next week I'm always saying that, right? I will be back next week for episode 50. Can you believe it? Episode 50 of The Leadership Lounge. You take care. Have a great week.